Hey guys, total misconception about Invisalign is it doesn't treat complex cases. Meaning sometimes some people think that if you have an underbite or a severe overbite that Invisalign can't help you. But I'm gonna walk you through a current case that we're currently following that you can totally see that we're able to take a pretty severe underbite and get her to follow the pattern of where she should be on Invisalign effectively and efficiently. So this is how she starts. We do a complete digitalized version of her teeth or anybody's teeth when they're doing Invisalign. And we use their x-rays. In our case, we use cone beam CTs and also panoramics, getting a full idea of what kind of dentistry they have in their mouth and what teeth can move and can't move. Like implants can't move. Crowns you can't put attachments on them. So these are some things that we have to actually be able to understand before we do the Invisalign. But you can see here, I'm gonna get really in depth here, but there is an underbite. Now on Invisalign, we do also have bands. So just like if you remember some people growing up, if you've never had braces, you might have seen people with rubber bands on their mouth. It's to actually sling either the teeth back or sometimes even forward. So in this case, we need to sling the bottom teeth backwards. And so we attach bands from the upper molar all the way down to the bottom. And you can slowly start to see this transition. This is currently where she's at. I'm actually gonna show you her picture of where she's at now. Now, since this is a model, this is a digitalized model, you can kind of see that the teeth look like they're disappearing behind the backs. Now, that's not how teeth work. They're not ghosts. They don't disappear. What that looks like in the mouth is what you're gonna see here in this video. So here you see that the patient's teeth are actually edge to edge. So this is a good transition point. This is where we want the patient. And a lot of the times we are adjusting the front teeth so that they are not hitting too hard on the front. And by adjustment, I mean just polishing them so they don't have interference. And slowly you're gonna start to see the teeth go back and they start to move back. So she went from a complete underbite to this edge-to-edge position, which is a great transition point. And then slowly we're gonna start to see her transitioning to the final.